So I'm glad you could come out today and talk about a really important topic. I think a lot of people don't want to talk about it, but I think it's very important to kind of bring awareness to it, especially this month, which is coming to the end of Colon Cancer Awareness Month. At UCLA, we've been kind of supporting Colon Cancer Awareness Month and celebrating it all month long, bringing awareness to the topic of colon cancer screening. So I'd love to talk to you more about that today. So one thing to just take away is you can stop colon cancer. And I really do like to think a happy colon means a healthy you. So it's one part of our bodies that we should definitely be taking care of. All right. So we'll talk about a few different things. First off, what is colon cancer and why you should care about it? So you hear a lot about it. I'll let you know kind of why colon cancer is a thing to kind of keep in the front of your mind and why to think about it. Next would be how to prevent colon cancer, the different options you have for screening, which there are quite a few, and then how you can actually help save lives just by spreading awareness yourselves. So why should you really care about colon cancer? First off, I guess let's just go through the basics of what a colon is. So in your body, it's located kind of in the lower portion. You have it's essentially called the large intestine or the large bowel. It's the very end of your digestive system. The digestive system goes from your mouth, your esophagus, your stomach, your small bowel, all the way down to the large bowel. So this is the very bottom portion of your GI tract. And it has kind of some basic functions of making stool and absorbing kind of water and salt from your food. And the rectum, which is the very, very bottom portion of your colon, actually holds the stool and stores it until it's ready to pass when you have a bowel movement. So colon cancer can develop from the colon in essence of the very kind of known pathway of how colon cancer develops. A polyp essentially is when you have a lump or a growth of cells. An abnormal growth of cells. And there's many different types of polyps. They all start off small, they can grow and become larger, and depending on the type of polyp, our pathologists help us when we remove polyps, tell us which type of polyp it is. The ones we care about are the ones called tubular adenomas, which are the most common and what we're essentially looking for when we're doing screenings, because these have the potential to become cancer down the line. Colon cancer itself is when this polyp has basically grown uncontrollably and abnormal cells become cancer. So it goes from polyp over into cancer. Okay, you have a question?
Do you want us to hold our questions?
Sure, you can ask questions kind of in the middle or towards the end, whichever you guys would like.
Okay. So are you saying that a polyp is always an abnormal cell?
Yeah, so polyps are basically always abnormal growth. There's some polyps that are called hyperplastic polyps, which are essentially a benign growth of cells that have no potential. So the differentiation is whether it's a potential to turn into cancer or not. So the ones that we care about are these tubular adenomas, which have a potential over time. That doesn't mean they're cancer themselves. It just means if they were left alone for many years, they have the potential to turn into cancer. Okay.
Oh, I have a question. Could there be something else to causing the polyps? Is it possible something? Let's say the other thing I think about is like spicy food.
Yeah, so we'll kind of talk about that in a little bit. There's some risk factors for colon cancer, but there's no one thing that we can say causes colon polyps or causes colon cancer. So I'll get into some of the risk factors. It's kind of multifactorial, and I'll talk about that in a little bit. Mm-hmm. So colon cancer is actually quite common, and it is deadly. It's actually the second leading cause of death among both men and women combined. So for men, it would be lung cancer, and then prostate cancer, then colon cancer is the third leading cause. For women, it would be lung, breast cancer, and colon cancer. So when you combine the two, for men and women, it really is the second leading cause of death for both men and women. So, and it's most often diagnosed in people over the age of 50, which is why we'll talk about kind of the screening guidelines, which say to start, screening at the age of 50. It's quite common. So over 140,000 people are diagnosed with colon cancer each year in the U.S. So, and 50,000 people die every year from colon cancer. So it's something that definitely is out there, and we kind of need to bring to the forefront. So we're talking about risk factors. So basically, everyone is at risk for colon cancer. The risk factors that cannot change are age. So age is probably the biggest factor, being over 50 years old. The risk increases especially. Being African American actually puts people at slightly higher risk for colon cancer, which is why we have slightly different screening. Ages at 45 instead of 50. There's also a family history component to it. So some people that have a very strong family history of colon cancer are at higher risk for that. So that's a question we always ask everybody who comes in. And then specific kind of situations would be if someone has a history of inflammatory bowel disease, or there's some special genetic polyp syndromes that put people at higher risk as well. So what can you change? So like I said, there's no kind of smoking gun that tells us you do this, it'll lead to colon cancer. But there's some kind of overall risk factors that that can be changed. So things that that can potentially lead to colon cancer, increased risk would be obesity, a diet that's low in fiber, high in red meat, diabetes, smoking, and heavy alcohol use. So you can see a lot of these are kind of lifestyle, general kind of changes, but you can't say that any one of these things causes colon cancer. It's more kind of the overall risk from all of these things combined. But that even the healthiest people who have none of these risk factors can still be at risk for colon cancer. And then symptoms, essentially. So I think a lot of people think that, with colon cancer, they'd see bleeding, constipation, or pain, and that's really not the case. Most of the time, a very large proportion of patients are completely asymptomatic, which means they have no symptoms at all. So by the time they're having symptoms, usually things have progressed further along, but things to kind of watch for, regardless, would be kind of blood in the stool, would be a change in the shape of the stool if it becomes very narrow as opposed to kind of your normal form, thicker stool. If you're having a lot of cramping, discomfort, if you're having brand new all of a sudden constipation that you didn't have before, that could be a warning sign. And then the big one also would be weight loss that you're trying not to lose, that you're just losing weight and you're not sure why. But like I said, by the time that kind of happens, most people are already kind of at a more progressed stage, which is why even without symptoms, the big thing we say is, it doesn't matter if you're symptomatic or not, screening is kind of for everybody. So how can you actually prevent colon cancer? Let's talk about the different types of colon cancer screening. So the nice part about colon cancer, it's one of the cancers that we have an actual preventative screening tool for. A lot of the other cancers, for example, lung and lung and prostate, you can't necessarily prevent. Even with breast cancer, you can do mammograms, but here we actually have tools where we can actually remove polyps early on and actually prevent them from turning into something. So colon cancer screening is a test that can detect and prevent colon cancer. Our guidelines basically say universally for everybody over the age of 50, and that's from our US guidelines for all adults in the United States. So when should you start? So for any average risk kind of person walking down the street, 50 is the kind of number to burn into your mind. So, and I think most people have probably had some encounter with their primary care doctor where they've at least mentioned the idea of colon cancer screening at the age of 50. So that really is kind of the number to remember in your minds. For African Americans, because they have a slightly higher risk, we actually say 45 would be the start for screening for African American patients. And then there's certain situations which we start even earlier. For example, if someone has a strong family history of colon cancer, or if they have a polyp syndrome. So that'd be something to discuss with your doctor. So if you have a known family history of colon cancer, even if it's slightly removed, you can always talk about with your physician, and they can advise you if you need to start earlier. Usually we say 40 if you have a family history of colon cancer, or 10 years earlier than the age that the family member was diagnosed. So if you have a mother, father, or brother or sister, a first-degree relative is the most important in this case. Let's say if your sister was diagnosed at the age of 45, then you should be starting your colon cancer screening at 35. So that would be a special situation. But in general, 50 or 45 for African Americans. And then the question always comes up, how do we do the screening? So this is where everyone, obviously, I think the colonoscopy is always the big one that comes up and people kind of worry about, but there are lots of options. So the good news is that you do have the options, and we'll go through some of them as well. And you can really decide which screening test is right for you. The most common ones that come up and will be offered would be colonoscopy and FIT testing, or fecal immunochemical testing, and that is a stool test. And we'll talk about both of those, okay? All right, so colonoscopy. So this is the one, preventative test that's performed in the hospital or in a medical clinic. It takes about 15 to 20 minutes. It's actually much shorter than people imagine. So a gastroenterologist, we use a colonoscope, which is basically a long flexible tube. It has a camera at the end with a light. It goes in through the bottom of the rectum, and then we look at the entire wall of the colon. It does require some sedation. There's situations where we can do unsedated colonoscopies if a patient doesn't want to have any sedation, but it's usually not general anesthesia. So when we say sedation, we're talking either monitored anesthesia care, where we have an anesthesiologist who's administering propofol through the IV. So you're still breathing on your own, but you're basically asleep. And the nice thing about that is you fall asleep really fast and you wake up really fast. Without much of a hangover effect. Most patients don't remember even having the colonoscopy. A lot of times I've had patients wake up and ask me if I've started yet, and I usually tell them it's already done. So that's nice. And then there's also a slightly lighter sedation called moderate sedation, where the gastroenterologist themselves is administering medications through the IV, Versed and fentanyl, and that's usually a slightly lighter form of sedation. So different kind of types of sedation, and unsedated is an option if somebody wants to do that. But we always kind of present these options to patients. The big thing with the colonoscopy is the bowel preparation. So to look at the colon, we basically want to flush everything out. It's like having a big colon cleanse. You don't want to see anything in there except for the colon. So stool is not helpful to look at, and that's really the part of the procedure I think patients kind of dread the most. And I have to say it is probably the worst part of the procedure, but the nice part is that once you've flushed everything out, the actual procedure itself is the breeze. Like I said, you'll sleep through the whole procedure. So usually with the bowel preparation for a colonoscopy, there's different types, and you can discuss kind of the different types with your physician, but essentially you end up drinking kind of a pretty large volume of fluid. We split it up into 2 batches the night before the procedure, and then usually 6 hours before the procedure time. And the idea is you're really just flushing everything out. You're going to have diarrhea, kind of have a big colon cleanse. I've had some patients say they feel great afterwards because it really lightens their load. So that's the requirement for us to get a really good look at the colon. Because we really want to see the walls of the colon, find these small little polyps. You can see the picture up there. Sometimes they can be very subtle, sometimes they can be larger, but we want to be able to pick up everything during the colonoscopy. And then in general, one thing to kind of remember, the colonoscopy is considered a very low risk procedure. There are, of course, risks anytime any procedures are done, but in the grand scheme of procedures, this is considered one of the lowest risk procedures. The main ones to be aware of would be bleeding, although it's very rare to have significant bleeding with the colonoscopy. And then tearing or perforating the colon is the most serious risk, but it's extremely rare for that to happen. 1 in 1,000 risk of that, and it's something that's kind of a theoretical risk, but we don't really expect that to happen for any given colonoscopy. And then in general, the colonoscopy really is the gold standard, the Cadillac of screening tests for looking for precancerous polyps. We can both detect a polyp and remove it at the same time. So we can, the procedure itself is both preventative and therapeutic in that sense. So you're finding something and removing it right during the same procedure. And then depending on what the colonoscopy outcomes are, it depends when your next one would be. So no polyps at all, your next colonoscopy would be 10 years. If you find one or two of those adenomatous polyps, which are the precancerous ones, usually 5 years. If we find more than that, 3 years, and then in rare circumstances, if we find larger polyps or more than 10 polyps, it can be closer to 6 months or a year. So it really depends on what your colonoscopy shows, but for most people with no colon polyps, it would be 10 years for their next one.
I have a question. How deep they go?
So so basically this is the colonoscope here. So this is going to the bottom of the rectum here. That's the sigmoid colon. That wraps around up into the descending colon transverse. We go all the way up to the cecum, which is the very end. And that's the area, that little squiggle there is the small bowel there. Sometimes we can go into there if we have to, but for regular routine screening, it stops right there at the very end of the colon. So we look at the whole thing. Yeah.
What about the one with a stick? Have you ever seen? It's a different way to do exam.
One with the stick.
Yeah, it looks like probably this long, right?
So the scope that we have here, it's a long flexible, so there's a handle on it. Let me see if I have a good picture for you.
I wonder.
So kind of like this little cartoon here is holding, there's a handle with the wheels, and then there's a long flexible tube that actually goes into the bottom and into the colon itself.
Isn't any another way to do that? Because I did it a long time ago, right? They did it like with a stick and then yeah, it's like this thick and then
Yeah, now they're actually quite thin. They're about this wide around.
So I wonder if they shoot through it because I don't feel it though. You're not gonna feel it.
You might have done a radiology exam, like a X-ray type of barium enema, maybe.
I think so.
Maybe, yeah. So
that's not.
yeah, this exam is basically just has a flexible tube.
I think this is more thorough.
This is actually, like I said, this is the gold standard. Basically, we can look at all the walls of the colon and then find polyps and remove them. Yeah.
What's the difference in a sigmoid and the regular colonoscopy? You only
The sigmoidoscopy? Yeah, so the flexible sigmoidoscopy that you're asking, the short one? Yeah, so the flexible sigmoidoscopy goes only up till about halfway through the sigmoid colon, about halfway through this part here, probably up till around here. It doesn't cross this kind of turn here. So you're basically looking at a third of the colon instead of the entire colon.
so why you only look at a third and not the whole thing?
Yeah, so we actually don't recommend, that's not our first line recommendation, doing the flexible sigmoidoscopy, but it's an option for, people if they, for whatever reason, don't want to do a full colonoscopy. Sometimes you can do less preparation with that, but it's actually wouldn't be my first recommendation. If we're going to do a screening test, a colonoscopy or a FIT testing are considered our first line screening test to consider. A flexible sigmoidoscopy is an option, but it's not one that we actively recommend. Because these are better tests.
Do you see everything with the sigmoid too?
Well, you see everything up until a certain point. You're not going to see the back half of the colon. You're only going to see up till here. Yeah. So it's kind of fallen out of favor as a routine screening tool, just because we know there's a lot of polyps and a lot of cancers that we can pick up on the right side of the colon as well. Yeah.
Is there any advantage to having both the FIT test and the colonoscopy?
Yeah, we usually say one or the other. So with the FIT testing, essentially, let me talk about that real quick. So the FIT testing is a stool testing that you can do at home. So the convenient part about it's a stool test as opposed to having a procedure, and it basically is looking for small amounts of blood, like trace amounts of blood that could be inside the colon. It's obviously very low risk. There's really no risk to that. You basically are collecting a stool sample and putting it into this little container here, and then you can even mail it off. But if it ends up being abnormal for any reason, if the FIT testing comes like positive, then the next test would be a colonoscopy to follow up on that. So that's more of a detection test. It's not a preventative test. So that's more detecting if there's a larger polyp that could have microscopic bleeding, if there's a tumor, for example, that's causing bleeding, then we would want to do the colonoscopy to actually find what in there could be causing that blood. Whereas the colonoscopy is more the preventative test where you're looking ahead of time, even without symptoms, even without any microscopic traces of blood, and we're finding polyps usually at a smaller point. Yeah, so we usually don't say to do both. Usually once you if you decide to kind of do the colonoscopy, you can go ahead and do that with the intervals, like either 10 years, 5 years. If you decide to do fit testing, then it's just something you would do every single year, unless something turns and you can keep doing that, and that's certainly possible. You just have to be kind of vigilant to do it every year. And then if it turns positive, then you'd basically be referred over to a colonoscopy. Yeah. So just to kind of go back to, I think I talked a little bit about, so I kind of mentioned that, what does it actually feel like? It really feels like nothing for most people because they're asleep. And like I said, I mentioned most people really end up saying, ask me when they're going to start, or that's it, or I had the best nap ever. That's usually what people tell me. Yeah, people tend to like the nap during the procedure. But the overall, so Ishara kind of mentioned, we have some really nice handouts kind of detailing exactly what happens before a colonoscopy, your preparation, what happens the day before, what happens during, you check in, what happens after the procedure. So I would definitely have you guys check that out. Either they have the handouts there or on the website, and I'll give you guys the website at the end so you can look and see kind of all the details about the colonoscopy. And like I said, I'm certainly happy to answer any other questions that you guys have about colonoscopy in specific. So we talked about fit testing as well. So I just wanted to mention that those are the two that you're probably going to hear about the most and that are recommended by most gastroenterologists. But the other screening options are available. One is a CT colonography, which is essentially a CAT scan. It's a radiology test. The downside of that is it requires the whole bowel prep like you would do for a colonoscopy. But if they don't find any polyps, you're kind of good until the next 3 to 5 years. But if they find any polyps, you're again having to go to do a colonoscopy and doing the bowel prep again and then doing that colonoscopy. So usually it's recommended for patients who are too sick to undergo a procedure or too sick to have anesthesia. But it's usually not our first line of screening. You guys might have seen, there's a lot of ads on TV lately about this new Cologuard, which is the FIT DNA testing. Again, that has a convenience of being something you can do at home. It has the FIT testing part of it, which picks up on the blood, but it also has a DNA part where it picks up on specific DNA that markers. But the kind of downside with that is it's not quite as sensitive, either as FIT testing or as colonoscopy. We don't have as much data on the Cologuard for long-term kind of as we do for the FIT testing, but it's also can be very expensive. So a lot of it is not covered by insurance. So colonoscopy and FIT testing both are covered by insurance for screening purposes, but the Cologuard a lot of times is not. So it's also not something that we kind of recommend as a first line, but it's something that is available. And then we talked about the flexible sigmoidoscopy, which doesn't really look at the entire colon. They're still in our guidelines, but most of us, if most people are planning to do a scope, we generally do recommend a colonoscopy just to get the full view of the entire colon. So the colonoscopy and the FIT test are really the ones that you want to consider. But you can always talk about if you have any questions and you want to talk to your physician, you can always bring it up and kind of decide what the best test is for you. So now the part about kind of saving lives and spreading awareness. You guys are obviously here because you're interested in colon cancer and screening, and it is Colon Cancer Awareness Month. So, but a lot of people, obviously, everyone don't like talking about colon cancer. It's kind of the part of the body that no one really wants to discuss or talk about except for gastroenterologists. So, but it's one of those things I think the more we talk about it, the less taboo it becomes. And I think if you spread kind of the awareness, just as we've done for lung cancer or breast cancer or prostate cancer, this is definitely a cancer that we can help to stop and prevent. And I think talking about it is helpful. So more and more people are getting screened. I mentioned it is affordable thanks to insurance coverage. So Medicare does cover the cost of the colorectal cancer screening test, and there should be no kind of out-of-pocket costs. And then, but obviously for some of the other testing, it's always a good idea if there are any questions to ask for specific insurance. But colon cancer screening in general at the age of 50 for average patient is usually covered by Medicare. So that shouldn't be too much of a burden there, and actually more and more people are getting screened. So between 2013 and 2015, 5% more people got screened for colon cancer. That's over 3.7 million adults more got screened. So I think the more we talk about colon cancer, the more people are getting screened. So, spreading awareness is good. Our plan and goal, there's a kind of a goal set for us by 2018, which is last year. We wanted 80% of people to be getting screened. We're not quite there yet, but obviously the more we kind of talk about it and the more we get people getting screened, the better. Colon cancer in general, probably, since the advent of colon cancer screening and its widespread use in the early 2000s, it's probably decreased colon cancer death by 60% or more, and decreased the risk of actual colon cancer by 90% from polyps since the advent of generalized colon cancer screening. So it's really something that makes a difference. But like I said, 1 in 3 adults are still not up to date with screening, so we definitely have more work to do. So the more we kind of spread the word and talk about it, the better. And you all probably know somebody out there who hasn't been screened. I always tell people, especially when they come in, make sure all your family members are screened, your friends, just kind of spread the word out there. It's something that I think for anyone who's undergone a colonoscopy, I don't know if anyone in this room has already done one or had fit testing. It's actually never quite as bad as people kind of make it out to be in their minds. So I think sometimes just more than having me kind of talk or having a physician kind of talk talking to each other actually is very helpful. So from someone who's actually been through it, it's nice to kind of hear reassurance for other people who are kind of thinking about getting their colon cancer screening. So we basically just want to make everyone a champion for colon cancer prevention. So just basically the message is to spread the word, talk about it, bring it up in your community, bring it up to people, and kind of make it less taboo, essentially. So just things to kind of talk about with their doctors, talk about it with their friends. Like I said, most people definitely agree that colonoscopy is not as bad as they had thought about in their minds, so that's definitely something to kind of spread. And early detection really is the key. So the idea is to find the polyps and not find the cancer. So we want to prevent these polyps from turning into cancer. Even if I find 5 or 6 polyps in a patient, it's a good day because you basically were able to get rid of that. I can say, I found these polyps, they're gone, they're removed, you're good, and we can see you in 3 to 5 years. So it's a nice feeling, yeah.
And is there a way to prevent polyps with a certain diet?
Yeah, so in general, like I said, there's no direct correlation. We always say high fiber, low red meat, low fat kind of diet, just like a general, quote unquote healthy diet. If you're a smoker, trying to quit smoking actually is helpful. Heavy alcohol use can be detrimental, so trying to, having moderate alcohol use versus very heavy. But the diet-wise really is like fiber, low red meat, but I don't tell anyone to change their diet completely, but it'd be, nice to kind of everything in moderation and to cut down things is helpful. Some people have polyps even with, like vegan diets of no red meat whatsoever. So I can't say there's a direct correlation, but it's a general guideline for healthy eating. Yeah.
So they grow, evidently they start growing way after 50. It doesn't happen before that.
So they can, polyps can occur for people less than 50, but the risk increases significantly after 50. So if someone were to get a colonoscopy for another reason, for example, rectal bleeding or some other reason, and sometimes I have found polyps in patients who are younger, but it's much rarer. Usually with age, these kind of little polyps grow more. So that's why 50 is a good recommendation, because we've seen that there's a pretty exponential kind of rise after the age of 50, but before there's not much kind of risk. Although there are some younger patients who have obviously had colon cancer, but that's more rare than over 90% are still found in people over the age of 50. So that's really the age group where we focus on. So kind of just a review here. So we kind of talked about how it's the second leading cause of cancer-related death. It really can affect anyone. People with colon cancer often have no symptoms, and screening prevents disease or detects the disease early. And basically the message is all adults need to be screened. And depending on if you're kind of an average risk adult, screen at 50, African Americans at 45, and if you have other risk factors or are concerned about other risk factors, please talk to your physician because it might need to be earlier. And there are options, and we talked about colon cancer and kind of fit testing as the two main ones. And, you know, we definitely want to make you guys kind of the champions for colon cancer awareness. So ACG, our main called gastroenterology, says get your colon screen in 19. And I would say get your colon screen in 19 if you haven't already done it, or if you're due for it. So it kind of depends on if you've had it or not, but you know, definitely get your colon screen. For additional information, this is the website here. It has all the information that Ashara mentioned with all the handouts. It has that kind of nice colonoscopy timeline table. It has our different bowel prep options. So a lot of information on that website. And if you have any questions, you can always feel free to contact my office. I'm at the UCLA Health office in Beverly Hills. And I scope over in Westwood at Ronald Reagan at the outpatient center. But I'm happy to answer any questions, and thank you for your attention.
Yes, is there any way